Malaria is a life-threatening mosquito-borne blood disease caused by Plasmodium parasite. It is transmitted to humans through the bite of the female Anopheles mosquito. The mosquito is a vector of the malaria parasite. An infected mosquito bites a human. The parasite then multiplies in the host's liver before infecting and destroying red blood cells. Over 1 million people die from malaria annually, and approximately 500 Australians are infected whilst travelling. There are various symptoms of malaria, most commonly including fevers, chills, and muscle pain.
Preventative measures can include wearing protective clothing, using insect nets, as well as the use of mosquito repellent. Are you thinking of traveling overseas? A better solution as a preventative and treatment method of malaria is the use of the drug Mefloquine. It's used as an alternative to chloroquine-resistant strains of the Plasmodium parasite. Avoid traveling to malaria-infected countries when pregnant, as malaria can spread from a woman to a child.
Hi Doc, I'm traveling to Africa really soon. Did you have any antimalarials I could use?
Right, yes I do. Do you have any allergies or are you on other medications at the moment?
No, not at the moment.
Okay, great. I will prescribe you with chloroquine. That works best.
Oh, but I've actually been on chloroquine before and I'm actually resistant to it. Did you have...
Well, you could actually use Mefloquine. That's also good.
But I've also heard of doxycycline.
Yes, that's good, but that works more for prevention. However, Mefloquine actually works for both treatment and prevention. And it's also used once weekly, so you don't need to worry about missing a dosage.
Oh, okay. Could you tell me how it works? Exactly?
Yes, I can show you a little video of how it works.
Mefloquine is an agent that is active against the erythrocytic stages of the Plasmodium species. However, it has no effect against the exoerythrocytic stages of the parasite. The Plasmodium species converts heme from the host's red blood cell to energy. Within the process, heme is converted to hematin, which is a toxic compound, hence it is then converted into hemazoin, a non-toxic compound. Mefloquine inhibits such a conversion, which allows toxic levels of hematin to increase, resulting in the death of the Plasmodium. It is very effective against malaria parasites resistant to chloroquine and in preventing malaria. There are many clinical trials that have been conducted to assure the effectiveness of Mefloquine since its discovery in the 1970s, as the world needed it after the resistance developed for the use of chloroquine. One study tested 7,148 patients in 18 clinical trials and treated them with different doses of Mefloquine. Only 9 adverse effects were reported. It was then concluded that the tolerance of a single dose is moderate but can be improved by administering it as a split dose over 3 days. The study also reported effects of dizziness, headaches, nausea, and vomiting for healthy volunteers. Another study tested a randomized group of 103 adults and children to compare chloroquine and Mefloquine. The study shows the high-grade chloroquine resistance to the parasites. Chloroquine had a higher failed treatment rate. There has been a successful use of Mefloquine monotherapy against chloroquine-resistant strains. Patients treated with Mefloquine showed a faster response to the treatment than chloroquine. This is why patients should use Mefloquine, and it should be the preferred drug of choice.
The prolonged use of Mefloquine is said to cause neuropsychiatric side effects, such as nightmares and suicidal thoughts, which can develop into chronic depression, anxiety, hallucinations, or even schizophrenia. However, the efficacy, safety, and tolerability of Mefloquine cannot be ignored. In 2015, 91% of malaria cases recorded worldwide was situated in Africa, and along with 65% of HIV cases. Unlike sulfadoxine-pyrimethamine, Mefloquine is compatible with its co-tremoxazole, a HIV preventative treatment. Thus, is significant in the co-prevention of HIV and malaria. Further, the increased susceptibility of pregnant women to malaria infection can be eliminated through the chemoprophylaxis of Mefloquine. Being a Category B pregnancy drug, Mefloquine are one of the few anti-malaria drugs which do not cause adverse pregnancy effects, including prematurity and stillborn. Hence, the increase of accessibility to Mefloquine to low-income and high malaria epidemic areas will end the cycle of malaria, contributing to a malaria-free world.